Hello everyone, this is Dr. Sean Morris. We are going over a TENS unit instructional video today. The objective with this is to explain how to use a TENS unit in detail at home. And this is what these products are for. They're designed for muscle spasm and pain, and these are usable at home by the patient themselves. So we're going to go over how to use one and how to start it up. So basically the TENS unit comes in a very nice package like this. At this point we would open this up. There's some paperwork that has to be filled out for insurance purposes. We also have some data on the actual company which dispenses them. So this is the company that does so. And that product is in there as well. With the TENS unit, we also get an instructional manual, which can be referred to at any point. We will not be referring to this today because we're going to go over it in my terms rather than this terms, but you also have this available to you in that packet. To start the process here, we want to actually show the patient that you can use alcohol prep pads. Alcohol prep pads are designed to be used in this product for using for the skin. And on the skin, we have oils, we have creams, we have things that can sometimes make the pads a little less effective. So by using an alcohol prep pad, we can clean the area prior to using the pads on that area. By doing that, you can the pads will last longer as well as they will work better. Okay, so that we always recommend using those, and they also come in this packet. To use the TENS unit, this is the actual unit itself. At this point, the battery's already in it. It runs on battery. It also runs on an AC adapter, so it can be plugged into the wall and can be used on both power sources. This particular unit comes with an extra battery as well, and that product is excellent to have 2 batteries for. In order to turn this on, it's pretty simple. Just like any other device in our society today, we actually use the primary button down the middle. We actually would hit that button. At that point, the machine would be on, and we can clearly see the indicated box, digital box that we can see with all the information on it. The 2 main points that we want to look at here are a T and S. The T stands for time. The S is setting. So the time, of course, is the primary spot in the middle there. You can actually see the C. That C means continuous. So that means that machine will not shut off until the power source is out, or if it's plugged into the wall, it will not shut off at all until the patient wakes up if they fell asleep. You can also change it to a 15-minute increment, a 30-minute increment, and a 60-minute increment. All the settings have a 30-minute increment. So at this point, you can basically use a 30-minute time period on each one. Really can't overdo it on this machine. If you use it and it's helpful and it's usable and patients are doing well with it, you can use it for any amount of time. It's really no contraindication to use it a little longer. It really is basically subjective. Subjective means that it can be used by the patient until they feel better and or the muscle spasm is lessened. Each setting is pretty simple. There's 10 settings, and in order to go through those and scan, you hit the button, and of course we can see each one going through. Each setting is designed to show for a body part, but we don't have to use that setting for only that body part. We can actually kind of subjectively use this, again, using the word subjective, because the patient would have to put the pads on, which we'll go over last, and they would actually feel each one of these to see if there's a certain sensation they like more. So it is a subjective thing, but you don't necessarily have to use the neck one on only the neck. The neck one could be used on any part of the body if it's a good setting for the patient themselves. So you can actually scan through each one of those to make sure you like one particular one. The next thing we want to talk about is how to actually turn the power onto the cable and or the pads. So once the pads are on the patient, once the cable is plugged in, which it will do so like this, pretty simple, and then once the pads are attached to these cables here, which we'll show you in a few minutes, we can then put the pads on the body after we've cleaned the area, put the pads on the body, and now we're ready to start the unit. So we have 2 settings. There's a channel 1 and a channel 2. Channel 1, channel 2. Each one of these can run 2 pads. So you can run 4 pads at one time using these 4 buttons. In order to turn it on, this is what I would call your dosage. So your dosage is you want to increase the dosage on the top part here. So you see 1, 2, 3. This goes up in some of these settings to 10 to 15. Where you want to really go with this, again, it's very subjective, so it goes by how the patient feels using this unit. But once you go up and you start to feel a sensation, which is usually a tingling, pulsing sensation, you then want to go maybe 1 or 2 points above that. So once you feel that, you then want to go 1, 2. At that point, that's where I would leave it, or if you can tolerate more, you can increase it even further. To completely turn it off, of course, you go down and you want to make sure you get that to a 0 count. Once that's to a 0 count, that means the machine is off and the power is off to the pads. You can do that again for both sides. So as you can see, channel 2, channel 1 and channel 2 over above each other, we can actually see channel 2 now moving. So again, this would be the dosage for channel 2 if you're running both sides. Okay, so that's pretty simple. So now we'll show you how to shut it off. So it's pretty simple to shut off as well. Obviously, just like any of our other products that we have nowadays, we can actually hold that button. Once the power shuts off on the machine goes off, the machine can be stored and put away at that point. So on to the pads. In the unit for itself, you'll get at least 3 sets of pads. We have a set of 4 pads, which are pretty simple to use. We'll show you those. And then we have another set of, I believe, 4 as well, and they're just a little different size. They're a little bit bigger. These can be used for larger muscle groups. These can be used for smaller, more intricate muscle groups, meaning this area could be, this one could be put on the neck area, and this one could be put on, let's say, leg muscles, calf muscles. So in order to show you the pads, we're going to pull them out of the unit here. When we pull these out of the sealed bag, they come on a plastic piece. This plastic is really, really important for the pads to be stable. When you remove the pads from this stable piece of material, you don't want to ever pull from the actual cord. We want to pull from where the pads stick to. So you pull them off in this manner rather than this manner. The reason why is we don't want to pull the cable out and actually tear the electronic component of this. There is no need for any water or any conduction material on these. The conduction material is already in there, and once they stick to the body, they are working. They're able to work. You can use these pads as long as they're still sticking and as long as they're still working. The company generally sends a whole package of these in the mail. Once you get these in the mail, you'll have a whole bunch to use, so you don't necessarily have to push it and use them too long. Once you are done with the pads, of course, off the body, we then want to place them back on the plastic piece and then, of course, slide them back into the container and make sure that the package is then sealed. By sealing it, these will last longer and they will definitely work better longer. So again, this is basically how to use a TENS unit, and we'll be giving more instructional videos on different things and different conditions very soon. Thank you very much, and thanks for listening.